Number 4, biceps pathology. The biceps actually is a long, thin tendon that comes up. Actually, you got the biceps muscle here, but you've got the biceps tendon that's about the size of a fettuccine noodle that goes all the way up the anterior aspect of the shoulder and dives deep into the joint. You also have a distal biceps, which is down below. So it's important to differentiate the two. Today we're talking about the long head of the biceps, which is up top, okay? So the way that usually presents is people, if you're very active and you like going to the gym and doing a lot of preacher curls or working out with the weights, some people may notice a little strain or a little pull in the anterior aspect of the shoulder. Another possible way to injure the biceps is through repetitive throwing motions, and we see this in a lot of patients that are like volleyball players or pitchers or throwers, or sometimes patients that have a lot of loose joints. And there are two mechanisms and two pathologies here we're going to talk about. First off is a biceps rupture or biceps tendinosis. Okay, a tendinosis is when you have damaged tendon, and a tendon, you get these small micro tears that you can't see, and those micro tears become degenerative, and they become what's called a tendinosis, and that weakens the tendon and sometimes can lead to a rupture of the tendon. So looking at the shoulder here, here's the ball in the socket of the shoulder joint. Once again, in the front of the shoulder, you've got the biceps muscle here, down here, and then you've got the tendon that runs in the front of the shoulder and then dives down deep into the insertion site, which is at the top of the glenoid up here. So many times what happens with repetitive activity in the biceps, sometimes you can get small tears in that biceps, small injuries, that heal in over time, and sometimes it can form some scar tissue, and that creates a little fluid accumulation, and then you develop a tendinosis, which is like a swelling or abnormality or weakening of that tendon. And sometimes you'll get to the point where you're doing an activity and you feel a pop, like somebody snapped you in front of the shoulder, and then you notice a lot of fullness here and a lot of bruising, and you get what's called a Popeye deformity. The reason it's called a Popeye deformity is because the biceps ruptures up here, it retracts, and then this biceps becomes a little bit more full because you're removing the tension off of the biceps, and then you get a larger biceps down distally. From a functional standpoint, it doesn't necessarily affect your function per se, but from a cosmetic standpoint, it may look a little off because you're asymmetric now because of your biceps. One's pumped up like that, like a Popeye deformity, one looks normal. If you catch this before it ruptures, there are some treatment options for that. You can actually do what's called the tendinosis, where you actually release the biceps up top and you bury it into the tuberosity here or into the shoulder with a screw to hold that tension on the biceps so it doesn't rupture and give you that Popeye deformity. Although you can still function with a Popeye deformity, you may just have occasional muscle cramps, and some patients may describe occasional weakness as well. But from a general functional standpoint, you can still do the majority of your activities. The next injury that we see a lot regarding the biceps is something called a superior labrum anterior posterior tear. It's also known as a slap tear. You read about it and hear about it in baseball players and pitchers and volleyball players. But this usually occurs when you have the biceps here and you're doing the repetitive throwing motion of the arm, moving the arm back and forth. It puts a lot of tension on this biceps. So the way I like to describe it to patients is if you're trying to pull a root out of the ground, and you grab that root and you rock it from side to side slowly to loosen that root and to pull it off. Same thing's happening with the biceps. With the repetitive rotation and the torsional forces across the biceps at this anchor, what happens is that stress continues to occur, rocking this bicep side to side, that it actually loosens and it tears right at its insertion site. So if you look at the cup here, which is the glenoid, if you look at it straight down the pipe here, this is what it looks like. It almost looks like a pear with a stem on top. This is the labrum around the glenoid cup bone here. This is the biceps, and this is where it inserts, and the tear usually occurs right up top here. And that's just one type of tear. That's the most common type. It's actually called the type 2 tear. There's a number of different types of tears there you can get. You can get sometimes splits into the biceps itself. You get splits into the labrum here itself. But either way, it's all secondary to that same torsional motion that I'm talking about regarding pulling and stressing that insertion site, creating a painful popping sensation when these people are throwing or doing their activities. Pitchers will notice a drop in their velocity. Volleyball players notice the inability to spike or swing their arms because of the severe pain and the popping sensation. Same thing with swimmers. The best way to diagnose this type of injury is with an MRI arthrogram, which you usually recommend going to your physician for an examination and possibly a test to rule this out.